All right, you guys, in this video, my wife, Catherine, is going to ask me some dental questions, hopefully with the goal of providing some more dental education to everybody. I'm a little nervous about how this is going to go because obviously my dental knowledge is not that good. So anyways, I hope this is a fun and educational video for you guys.
All right, let's go. So first question, Conan, are you ready? What do you call a bear with no teeth?
I don't know.
It's a gummy bear.
Oh, okay. All right.
Woo! First dental question done.
Okay. Zero out of one. 0 out of 1.
We have a fun story behind this question.
Yeah,
But how many permanent teeth does an adult have, and what about children?
I realize this is the first time Chase's face is going to be on YouTube, which is really cute. That's our son, Chase.
Yeah. Have you been trying to avoid having Chase online?
I was, but now I think maybe I should show him more because he's really cute. Yeah, and I feel like it'll be good because then he can see himself like growing up on the channel.
He's already one.
Yeah, that was his 1-year photo shoot. But anyways, this one's pretty easy. So adults have 32 teeth and children have 20.
Amazing.
That was a difficult question because when I was a med student, I proudly proclaimed that children had like 36 teeth when I was asked by one of my EM attendings.
I remember Conan coming home and being like, I was really proud. I raised my hand and said, my wife is a dental student. People have 36 teeth. It's like, oh, no, we have to educate. So most people have 32 teeth. Oftentimes people take out their wisdom teeth, so 28 teeth, but I have 24. Sometimes people take out 4 premolars for orthodontics. This is less so done nowadays just because people intervene earlier and they can prevent having to take out teeth for crowding. So tell me, what's A, B, and C in this photo?
Oh, so this is enamel. This is the outer hard layer, which is what contacts the food. And then you have your dentin, which is under your enamel. Amazing. And then for C, this is where you have your pulp. And this is where you typically work. See, I know everything.
He knows everything. So exactly correct. A was enamel. Enamel. Did you know enamel is the hardest substance in the body?
No, I probably heard that at some point.
It's the most mineralized substance in the body, so super hella strong. So it's really good against cavities and all the things that we do to it. Dentin, do you think it's stronger or weaker than bone?
Dentin, I feel like it's probably pretty soft.
It's pretty soft.
Yeah, because it looks kind of brown here, so that means it's kind of soft.
Oh, okay. So enamel, super hard. Dentin, less hard, but it is stronger than bone.
Oh, okay.
Yeah.
Okay.
But it's more flexible than enamel, so sometimes if you shine a bright light on your tooth, you might see little crazed lines on enamel. Enamel can become pretty brittle. Teeth can crack sometimes under forces, but dentin is more flexible, so it tries to help with preventing cracks from forming. And pulp is our favorite place. It's where the blood vessels and nerves are inside the tooth, and it's really helpful for providing nutrition to the tooth. It's where you have your nerves located, so it helps with sensory. It's also where your immune system's located within the tooth to try to help fight and prevent infections to some extent. So what's an endodontist? What do we do?
So an endodontist is a root canal specialist. So they go in mainly into the pulp to, when like there's a really bad infection here, they had to go in here.
Using the slides.
Of course. Yeah, it's very visual. And so, people start to get really bad pain because the nerve gets all inflamed and infected with all this bacteria. So they go in and they do a root canal, which is kind of drilling in and clearing out all that infection that's in the pulp here. And that is what you guys do.
Okay, awesome. We're known as specialists of saving teeth, also the root canal people. We do a little teeny tiny bit more than root canals too. Root canal treatment is probably our bread and butter. Also root canal retreatments, doing root canals again in case the primary root canal has failed. Root end surgery is something we do where we, instead of going from inside the tooth, we come in from the gum and bone side and take away the infection that way. Internal bleaching, that's when teeth get discolored mostly from trauma, and we can try to whiten the tooth from the inside. You have to first do a root canal before you can internally bleach. Trauma management, so whenever people come in and their tooth came out or the areas got broken. We try to manage that. Apexification, vital pulp therapy, and pulpal regeneration, those are more for procedures with immature teeth, and we can maybe go into that in another dental video. So can you describe how caries forms?
Yeah, so basically, you get sugar and all these other things that build up on your teeth, and it creates a very acidic environment. And over time, that erodes your enamel. And when the enamel is eroded, the bacteria just starts to go crazy and it starts to live in there. And then you get a carie or dental caries or a cavity, right?
That's so beautiful. I'm so impressed. So, yeah, good job. You could tell that Conan's around dental people often. So cariogenic bacteria like S. mutans, L. bacillus, they eat sugars and carbs, and they produce a mix of acid and enzymes, like you said, that dissolve the mineral contents of enamel and dentin and breaks down organic matrix. So not great to have. This is also why maybe if you read mommy baby advice, they say don't ever lick the spoon and then give it to your baby, because this actually transfers those cariogenic bacteria earlier on. So that's not so great. You can try to prevent giving them these bacteria early on. And what's the recommended amount of time to brush your teeth?
Oh, come on, this is easy. 2 minutes. Everybody needs to brush their teeth for 2 minutes.
Is this common knowledge? It probably is.
Yeah, this is common knowledge.
Good.
Yeah. I think. I don't know.
So. Yeah, I hope so. This is Chase. He's trying to brush his teeth. He loves his toothbrush. At 1 year old, we did like that thing where we ask Chase, what occupation are you going to have? And we put a whole bunch of stuff around him. What did we put around? Do you remember?
Yeah, we put basically a stethoscope, a gaming headset, a ball for sports, and like a credit card for finance. And out of all those objects, the one he chose was a toothbrush. And he's really addicted to his toothbrush, actually.
Yeah, so future dentist, I hope. Maybe we'll see. We'll see what he likes. So 2 minutes, 2 times a day, floss at night. Pretty self-explanatory, but real important.
There were actually some other dental videos that I wanted to show you and get your reaction on.
Yeah?
So maybe we should do that after, like maybe not today, but maybe we could do it in a future video. There's some controversial things that were kind of interesting.
Well, maybe if before Pulpal comes back from daycare, we could do one. So fluoride, it's really good stuff. What does it do?
I don't know exactly how fluoride works. I don't think they even know how fluoride works. They're just like, we just put it on and the outcomes are better. I don't think they know. So
is that your answer?
Yeah,
that you don't know. I don't think anybody knows.
I don't think dentists even know how it works. So basically, it like increases the mineralization of your teeth by unknown mechanism, right?
Okay. Well, did you know that Davis is not fluoridated? The water? It's kind of surprising to me. Fluoridated water has been so great for preventing caries, especially in kids. And the most common chronic disease in children is actually caries. Yeah, somewhere on the internet it was like, well, I thought it was asthma, but no, it's dental caries. Did you know that?
Okay, but how does fluoride work? You're evading the subject right here.
You can cut this out. So, fluoride is great. It remineralizes tooth enamel. That's a big thing. It actually forms this thing called fluoroapatite, and that's super strong. It's really good against acids. It's stronger than what is like your natural tooth hydroxyapatite. So it's really, really great. Exerts antibacterial properties. The one that I learned in dental school was it inhibits enolase in bacterial glycolysis.
Whenever I see stuff like this, I always wonder how did people discover this stuff? Like, did they just randomly start applying random chemicals to everybody's teeth just to see what works and what helped and what didn't?
That's true. That's a good point. I don't know about that. But yeah, it's really good stuff. Prevents decay, prevents breakdown, and remineralizes enamel. What should you do if your primary tooth gets avulsed? And you know what a primary tooth is, right?
So if it's a primary tooth, that's a baby tooth. So just throw it in the trash. Well, no, that's probably not the right answer. You could probably still put it back in their mouth. You could put it in either, I think they said put it in, your own saliva is like probably the best. Milk is like, you could do, but it can cause caries. But like, I think it's kind of one thing you could do. Your own saliva is good. Put it on some ice. Go to the dentist right away. I think that's the answer.
Wait, why did you go back? You literally.
Oh, I said the right answer? Oh.
You literally started off by saying throw it in the trash. That's probably the best answer, yeah.
Oh, well, yeah. I thought.
But then
okay.
you backtracked.
Okay.
So if it's a primary tooth, probably throw it in the trash, or you could keep it and save it for your kid to put it under the pillow so that they can get a tooth fairy money from it. But yeah, leave it out. Yeah. What were you gonna say?
Okay. So I was half right. Partially right.
I don't know. I think it's wrong if you change it to the wrong answer. But go to a dentist too, especially because they will check if the whole tooth came out or if there's still fragments either inside or if there's fragments inside your lip. They'll take some x-rays to see what's going on. Sometimes if it's a primary tooth, it's important to maintain that space so that your teeth don't shift in a funny way, so eruption of your other teeth gets wonky. Also, when it comes to that, it's for aesthetics too. They might want a removable appliance, things like that. And what should you do if your permanent tooth gets avulsed? So permanent tooth.
All right, I'm basically my same answer from the last one. So put it in saliva and ice and go to the dentist. I guess milk, I think it was like not as ideal because it's like all sugar.
So imagine what if this happened to you? That's what you would do. You would put it on.
I would call you right away. So I would have the answer.
What? Okay. So,
I think the other alternative is people could just Google what the right answer is.
That's true. When in doubt, Google. It'll tell you what to do. Would you try to put it in yourself?
No.
Why?
I wouldn't know I wouldn't know how to put it back in.
Okay.
It would probably just fall out again,
fair.
and then I would drop it down the sewer drain and not know where it went.
Fair. It all comes down to comfort level. So technically, and I don't know if this is a little bit too bloody to show on your YouTube, should be okay. Technically, if it happens, the best thing you can do is put it back in. If it's dirty though, you want to make sure that you clean it a little with rinsing it, preferably with milk if possible. You said milk. You could also use your own saliva. People say in the literature, don't use water. It actually is no bueno. It doesn't have like the
just think about any kind of solution. If you put water in it, it's like completely hypotonic compared to your cells, so it's just going to draw all of it's going to go into the cells and just cause like a bunch of lysis and explosion and everything.
But basically, put it in if you can. Make sure you put it in the right way. Sometimes it happens where people put it in the opposite direction. It's like, ooh. Make sure you don't touch the root, so touch the white part, the crown of it, just because the cells that you want to protect are the ones on the root. If you can't replant it, if you're not comfortable doing that, then do put it in a storage medium. Most literature says milk is the best. What percent of pulps die after a traumatic incident like falling off a bike?
So there's a really good rule in medicine. It's the 20-50-80 rule, which means whenever somebody asks you a question, most likely the answer is 20%, 50%, or 80%.
What?
So let's go with 50% on this one.
What? Is this how you guys answer your like boards questions? And it's like, I'm not sure, but it has to be 25, 50, or 80. That's funny.
Dr. Lau taught it to us.
So this was kind of a gimme, I feel, because technically you could say any percent and it might fall in the spectrum. It's funny that you say that because it's 85.
I told you it's always 20%, 50%, or 80%. It never fails. It's always the right answer.
So it depends on how much you traumatized your tooth, what type of trauma. The worst is actually when you intrude a tooth. That means it goes up or like into your socket. Lateral luxation is second worst. That's when it's kind of laterally pushed. Extrusion is where it comes out but not completely. Avulsion is when it completely comes out. Subluxation is kind of when it becomes loose, and concussion is when you just kind of like you could cuss it. Sorry, that's not very explanatory. But avulsions, actually I say intrusion was the worst, but if it's a mature tooth and avulsed, that's the worst. And
But I thought you said if it's avulsed, you just put it back in.
you do, but pulpal necrosis is different than just having your tooth there. So unfortunately, if it's a mature tooth, meaning the roots have fully developed, the chances of it revascularizing, meaning the inside nerves and blood vessels becoming usable and workable again, is pretty much 100% not gonna happen. Sometimes with immature teeth, so that's where the root is not fully formed yet. When you put it back in, it's kind of wide enough to allow for some revascularization, but still that doesn't happen very often. So 82% still necrose with that. Good question. What is apical periodontitis? How does it develop?
So this is an infection. We see this actually on CT scans sometimes. If you get like a CT sinus or even like a CT head, sometimes you'll just see, they'll comment on apical periodontitis. And basically it's just an infection at the apex of your tooth root, is my understanding.
Pretty much. How does it develop? What causes it?
It's probably, people get an infection, a cavity that starts to spread into the pulp. And then once it spreads into the pulp, it just continues traveling down until it gets like all the way to the edge at the bottom of your root.
I love it, Conan. So
see, I'm doing better than expected, aren't I?
I expected you to do really well. Yeah.
Okay.
So with these x-rays, you can see kind of this dark shadowing, kind of like how Conan said you could see it on CT scans. This is on the right-hand side is CBCT. That's what we normally use in our practice, a cone beam computed tomography. That darkness is actually showing bone loss. Bone is getting damaged where the root canal exits. So we said the pulp lives in the root canal, and when bacteria gets into your pulp, then it starts infecting it essentially, and the body starts reacting with immune response to fight that, and it leads to damage with osteoclasts getting activated. So you need bacteria for this to happen. So can you name some ways bacteria can get inside a tooth?
So externally, via the normal route of a cavity forming on the outside and then going in, you can have trauma, especially if you have like a cracked tooth. They can get in through those little cracks. I don't know how else they can get in a tooth.
Yeah, maybe brainstorm. Think about what other possibilities.
Dental procedure. It wasn't done sterilely. Iatrogenic.
Cavity, you said. Deep restoration. So usually I'd say that's because there was a cavity. Further you drill, the closer you are to the inside of the tooth, the pulp. Cracks you mentioned. You could see on the bottom here, crack line, and bacteria love to live in those little cracks. And if the crack is deep enough to get into the pulp, then you can get bacteria in there. Trauma, like we talked about, you can really cause some bad things with trauma, leading to bacteria in there. Developmental, so some people grow their teeth a little differently, and this is called a dens evaginatus, dens invaginatus. With dens evaginatus, it has these like tubercles where you can have sometimes a pulp up there. So with wear, that can sometimes get worn down, allowing for bacteria to enter that little area. Dens invaginatus, this is also called tooth within a tooth, and bacteria can tend to travel inside those teeth easier than a normal tooth. Attrition, with grinding, you could even just literally grind your tooth down so much that your pulp show. Erosion is with acid that can kind of slough off tooth structure. Abrasion, that's really intense toothbrushing. Sometimes I see people trying to do a really good job of cleaning their teeth, but in the process it damages it so far that they're into their pulp. And abfraction is kind of for People who put forces on their teeth, even clenching, can lead to breakage, kind of in that cervical area where the root meets the crown, and that can get so deep that it gets into the pulp sometime. Can you roughly describe the steps of a root canal treatment, start to finish?
Okay, guys. So first, we got to get on our sterile field, which in dentistry is called a rubber dam. But actually, before you do that, you might want to numb the patient. So let's get our big injectable, needle, numb up the gum, figure out where you got to go. Then get that big green rubber dam. And then you get your drill and you go bzzz, and then you like try to find the root canal. It's really small, so you got your little loops and you're like looking in, really trying to figure out where you're going. And sometimes you have to just like feel where the root canal is. Sometimes you don't actually know like where it is. You just go by feel. And then all of a sudden, all the pus is gonna start coming out. It's like, and then it explodes. And then you suction that all out, and then you do some root canal bleach, some hypochlorite, get that hypochlorite all in there, and then just like clean that all out, clean that baby out. And then you're going to put, what's that thing called?
What are you thinking?
That material.
Which one?
With the weird name. Gutta percha, yeah. Then you gutta percha it up, and you don't actually close it because you actually like send it back to the dentist, and then you have them do the final crown and everything. So yeah, that's basically how you do a root canal.
Oh, I love many parts of that. I feel like we need Conan's energy in our clinic, because when we describe it, I feel like it's very matter of fact, but when you describe it, I feel energy. I feel excited to get it done. So yeah, you mentioned a lot of stuff that I wasn't even going to talk about, but I feel like...
See, I know this stuff.
It was so detailed. You do need to get the patient numb. That's really important. When patients come in, they're often afraid. They're like, oh my gosh, a root canal treatment is going to be so painful. I'm so scared. And we understand that. People talk about it and say, root canal treatment, it's going to be so bad. But oftentimes we hear patients say, that was so painless. We really like to hear that. Often it's people coming in with a lot of pain and then leading to them needing the treatment. So maybe that association is where the pain comes from. Thankfully, modern anesthetics have allowed us to make it very comfortable. There's a lot of different ways that we can numb a person to make sure that it's numb even before we get started. Rubber dam, sometimes it's blue, but it's like a sterile field. It allows us just to see that tooth, and that's really important because we don't want saliva getting into the tooth, more bacteria getting in there. We also don't want any of the stuff we use. We don't even say the word bleach or sodium hypochlorite when we're working, because people don't want to hear that when we're doing it.
And whenever there's bleeding, which there always is, they're just like, oh, there's some heme there. They don't say blood. Oh, I see a little bit of heme, you guys.
I mean, imagine if you're getting worked on, it's like blood. Oh my gosh, there's blood. And get the bleach, please. Get the bleach. The rubber dam helps us prevent bleach from getting down their throat. Anything, the files that we use, the water, so it's very comfortable. Everything behind that dam is just saliva, so they can either swallow it or we can suction it up. But back to root canal treatment, Conan was right. We go right into the top of the tooth in order to get into those little pathways. We use a microscope. You could also use loupes, but the magnification is usually not as strong. Microscopes are great because it makes us sit up straight, and it's very good for ergonomics. We use little files in order to disinfect inside, along with irrigants. That usually includes bleach, which is our best friend, along with EDTA, which helps get rid of inorganic debris. Bleach is more for organic debris and as an antimicrobial. After that, you put in gutta percha. When we put in the gutta percha, we also put in sealer, so it really fills in the nooks and crannies of that pathway system. Then after that, we don't leave it open and just send it back to the dentist. We usually put a temporary filling unless the dentist wants us to put the permanent filling ourselves. So can you tell me what's going on in these x-rays? What are your treatment options?
Oh my gosh, this is too easy, you guys. Come on, look at this huge periapical lucency right here. And then on CBCT, I mean, it's clear as day, right? So, this patient has had a root canal before, actually. So something must have happened to that root canal. Maybe it didn't get all the way to the bottom. Maybe it was like an insufficient root canal. So whatever the case, there is some persistent infection there. So we may have to do a retreatment, also known as an RTX, or we may have to do a periapicoectomy, which is when we're
Wait, what did you say?
or we may have to do a periapicoectomy, depending on the anatomy. Okay. Maybe we'll have to cut into the gum and go in from the back end. You know, what if this is all like calcified and we can't get down there anymore? So those are your treatment options, you guys.
I feel like Conan picked up a lot of nice information. So he's absolutely right. There's a periapical lesion here indicating that there's likely some persistent infection happening after a root canal was already done. Success of primary root canal is actually really good. It's around 80 to 90%, usually lower when there's already an existing periapical lesion. So that's more around the 80%, but it takes 1 to 4 years-ish for bone to show healing. So one good question to ask right off the bat is, when was it done? So if they're still within that time frame, then maybe there's still a chance for healing as long as they were asymptomatic and not having any additional signs of infection like sinus tracts or swelling. But when it comes to treatment options, certainly the options include trying to do the root canal again. That means getting inside the tooth, disinfecting, taking out the old materials, and seeing are there any other nooks and crannies to clean in there. Second option is, Conan said, periapicoectomy. Technically, apicoectomy, also known as a root end surgery, where you come in from the gum and bone side in order to remove that infection. It's a little tricky with bottom teeth because you do have the mandibular canal, mental nerve, and you want to make sure that you don't risk paresthesia for the patient. Third option is taking out the tooth. That's always on the table, and some patients say, I don't want to keep on saving this tooth, and that's a valid option. Fourth option is doing nothing, and we normally discourage that, especially if there's signs of persistent infection.
So if that's the answer on your board exam, don't put that answer.
So yeah, here you can see.
Just look at this beautiful healing, you guys. Like already we're seeing some immediate improvement here. Look, they missed this little tiny medial branch right here. That's probably why there is persistent infection. And now 1 year follow-up, almost complete resolution of the periapical lucency. Wow, what a great root canal.
Oh. So you really can't tell any healing probably in this image right here because it's immediately post-op and you're probably not going to see healing on the same day. It does take, again, 1 to 4 years to show healing, but it was nice to see a little bit of anatomy getting captured there, getting things a little clean. So this is the last question. What is this?
So it's an oral lesion. It could be from trauma, but I think whenever you're concerned about an oral lesion, you're just going to have to ask yourself, could this be malignancy? So I would ask my dental colleagues, is this concerning or not? And then the other thing I'm thinking is, is this something procedurally that happened, being that we're talking about root canals and stuff here. But I think the primary thing I would be focused on is ruling out malignancy.
So with this right here, it is a sinus tract, although Conan is absolutely right. I think just with one image alone, especially when you're not clinically examining, it's like, what is that? It's hard to know. What is a sinus tract? Usually you can poke into it. It's almost like a pimple with a hole in it, and it's draining an abscess. And when that's the case, it's really just following the least resistance through the bone, periosteum, and mucosa of the skin. It's really important, though, to, like Conan say, rule out other reasons. There's so many different types of oral lesions that can form, and malignancy is definitely on the radar, especially if you see other signs of endodontic disease in the area, and along with the presentation of a pimple with a pokeable hole on the inside, then it certainly makes you more inclined to say, oh, that's a sinus tract. With those little guys, you can actually send a stick of gutta percha into it. And you often don't have to numb the patient. You could just stick it in there and then take an x-ray, and it'll help you see where is it going. And that's called tracing your sinus tract. And that tells you, hey, that's like a pointer to where the infection's coming from. This is pretty cool. It's a case in the literature where that sinus tract, you can see it's located next to this molar. That's tooth number 19. And number 19 you can see is right here on the x-ray, but with that little pointer of gutta percha, you can see it's actually pointing to this tooth number 20. And that's where the infection's coming from. You can see that periapical lesion. Yeah, they did a root canal on tooth number 20. It's hard to see with periapical radiograph, which is kind of where you see the whole tooth along with the roots about where exactly how big fillings are, but the filling actually looks a little deep here, but again, no periapical lesions. This looks like the periapical lesion has healed. I didn't actually read how long the follow-up was for when this x-ray was taken, but you can tell that that sinus tract had healed. Periapical lesions can happen without sinus tracts, of course, but 18% of the time there's sinus tracts with teeth with periapical lesions. Yeah.
And so numbering your teeth, you guys, easy way to remember, top right is 1, and then you go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 to 16, and then you go straight down onto your bottom left, and then it's 17 through 32. Yeah. So easy way to remember your teeth numbering.
Yeah. So this was fun. It's nice to hear Conan's energy when it comes to dental questions. It makes me want him to like just explain all procedures. Yeah. We should just have a recording of your YouTube of what is a root canal and play that to everybody. But yeah, for another time. This picture is literally taken like an hour ago when we left the cafe. But that was fun. Yeah.
All right. Hope you guys enjoyed this video. Let us know in the comments down below if you have any questions or if you'd like to see more dental videos. I think there's some controversial YouTube videos we could possibly review. Okay. But anyways, this was a fun little adventure, and thank you guys for watching. We'll see you in the next video, and peace.
Bye.